Good evening. I'm psychiatrist Jay Fauver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And let's start with a couple emails I just received this past week. One reads, Dear Dr. Fauver, does coffee or caffeine in general help with ADHD, or is that a myth? Not really a myth, because I always say that the coffee shops are filled with people with attention deficit hyperactivity disorder because they're using the caffeine in the coffee as a means of mitigating some of their symptoms of inattentiveness and distractibility. Now, here's how that works. When you think about caffeine, it's mainly for the purpose of keeping you awake, and that's why people will often use caffeine as the day progresses, because as the day progresses and your brain gets tired, it's like these fumes are being released in your brain. It's called adenosine. Adenosine fumes will just make you tired and sleepy and make you less motivated as the day goes on. If you get a nap for about 30 minutes, those fumes get released and they get eliminated. Or if you use caffeine, caffeine to the brain looks like adenosine. So caffeine will go to those little adenosine receptors and just knock them off, and that gives you an awakening effect. Secondarily, caffeine will increase dopamine and norepinephrine transmission. And that's what you're trying to increase with the treatment of ADHD. With ADHD, you have less dopamine and norepinephrine in the front part of the brain, which is the thinking part of the brain. That's the part of the brain in which you use to pay attention and to decrease distractibility. If you can increase dopamine and norepinephrine transmission in the front part of the brain, you'll have improvement with concentration and focus, especially if you already have ADHD. So how does caffeine do that? Well, it's going to increase dopamine and norepinephrine, but it does so over the course of maybe an hour or so. The drawback of caffeine, it's a very short-acting substance. So the best way to use coffee or any kind of caffeinated beverage is to slowly sip it over the course of 2 or 3 or 4 hours, trying to decrease the amount that you're consuming to the point where you're not getting physiologically dependent on it, where you are noticing a big crash afterwards or getting a headache without it the next day. You want to have enough of it where it's doing you some good. And usually we're talking about 2 or 3 medium cups of coffee a day. So that's what most people are able to tolerate. That's what works for most people. But you don't want to knock it down in about 15 minutes. You want to sip on it over the course of 2 hours to really help with focus and concentration. Now, there is a phenomenon called a coffee nap, where people will drink a cup of coffee over the course of 15 or 20 minutes, have about a 20-minute nap, and then upon awakening, they have a lot of attentiveness and focus and energy. And that's something that is legitimate, because the coffee might not kick in for about 20, 25 minutes after you consume it. And that's why a coffee nap can be very, very, very effective for a lot of people. And that's where you drink a cup of coffee first, and then you have a nap for no more than 30 minutes or so, and upon awakening, you tend to be wide awake and very alert and have exceptionally good concentration at that time. But yeah, caffeine can be used over the course of a couple hours, 3 hours, for the purpose of helping with concentration. That's why I'm not a big fan of people taking a caffeine tablet of 100, 200 milligrams at a time, because it's going to work so quickly but so briefly that it's not going to do you a lot of good. Thanks for your email. Let's go to our first caller. Hello, Dustin. Welcome to Matters of the Mind. Well, Dustin, you want to know, why do you have the same recurring dream over the years, or is it a form of deja vu? Dreams are very abstract, Dustin, and dreams are not supposed to make a lot of sense to you, because when you're dreaming, the logical part of your brain shuts down. And it makes sense that that would happen, because your logical part of the brain is using a lot of glucose all day. It's using a lot of energy, and you're trying to think, and you're kind of trying to concentrate all day, and it's building up all this adenosine. You get tired as the day goes on, then you want to crash. Well, this part of the brain needs to rest at night, and when it's resting, the logical part of the brain rests, that's when you go into REM sleep, rapid eye movement sleep, which is dream sleep. Dream sleep by nature doesn't make a lot of sense because the part of your brain that you're using to try to make sense is shutting down. That part of the brain is resting. So dream sleep is normal. Dream sleep is very effective for recharging your ability to pay attention the next day and be able to generate the ability to download memories the next day, because this front part of the brain will allow you to generate memories in the middle part of the brain down here called the hippocampus. So when people start having less dreaming over the years, they can have less difficulty or less ability to download memories and have more difficulty paying attention. So that's why it's exceptionally important that as a psychiatric vital sign, we're always asking about sleep. We want to know if somebody's able to get to sleep. Do they stay asleep? Are they awakened by bad dreams, which is a whole different phenomenon called nightmares? We want to know if somebody's able to concentrate. Do they feel awake and refreshed upon getting up? It's okay to have a cup of coffee in the morning to get the brain kind of charged up some, but overall, you shouldn't feel just as tired when you get up compared to when you went to bed. So you should have a refreshing sleep. Typically, that's anywhere between 7 and 9 hours for most people. For occasionally, you'll hear about 10 hours, but you want to know that somebody's getting a good quality of sleep. But part of that good quality of sleep is being able to dream where this front part of the brain, the logical part of the brain, is shutting down. Now, you remember, with dreams, they're like a whiteboard. Upon awakening, unless you write down your dreams, unless you think about them, unless you talk about your dreams and try to figure out, how does that relate to what I've been going through day to day? Unless you talk about them or think about them, those dreams get wiped off your memory really, really fast. That's why, well, for many of us, we can't remember what we were dreaming about last night. Here it is in the evening. We can't remember what we were dreaming about last night unless we talked about it. And the same is going to happen tonight. We'll dream, but we won't remember it because that's what happens. This whiteboard gets wiped off very, very quickly upon your awakening. Thanks for your call. Let's go to our next caller. Hello, Janet. Welcome to Matters of Mind. Well, Janet, you want to know if you need a referral from your doctor to make an appointment with a psychiatrist. It depends on what kind of mental health clinic it might be, Janet. For many mental health clinics, my preference would always be that nobody would need a referral, that you'd just be able to see somebody. If you talk to a scheduler, they'd be able to get you set up with the right person at the right time. But for some mental health clinics, they do need a referral from a primary care doctor first to make sure that it's a legitimate psychiatric concern. But more often than not, if you have a scheduler navigator who can get you into the right spot and have you see a therapist, have you see a nurse practitioner, have you see a psychologist or a psychiatrist, that's going to always be best for you. So the whole idea of getting a referral is for the purpose to make sure you're getting to the right person at the right time. So you'd have to check with the individual clinics, Janet. Janet, thanks for your call. Let's go to our next caller. Hello, Peggy. Welcome to Matters of Mind. Peggy, you mentioned you had a stroke 6 years ago, and now you're crying nonstop. You never know what triggers it. What's a symptom? Is that a symptom of a stroke, and what can you do about it? Peggy, I imagine you had a stroke that affected somehow, some way, the front part of your brain. When you have a stroke that affects the front part of the brain, and sometimes the side part of the brain over here, this would be called a middle cerebral artery stroke. Sometimes that'll affect the emotional aspect of the brain itself. But the bottom line is, if you're crying nonstop, that's a really good scenario where, as long as you didn't have a hemorrhagic stroke, if it was an occlusive stroke, where it was a blood clot that caused you to have decreased blood flow to certain parts of the brain, you could take a medication that's going to affect serotonin. If you increase serotonin in the brain, it'll dampen down excessive emotions. And by dampening down excessive emotions, what I mean is you're not as likely to cry all the time. So if you take a medication like Zoloft, Celexa, Lexapro, Paxil, Prozac, these are medications that are primarily increasing serotonin, and in doing so, they're dampening down the excessive emotionality some people can have following a stroke. Now, that's one treatment option. Now, some people have a hemorrhagic stroke where they have a brain bleed, and those people have to be careful with any medications that are prone to just increasing serotonin. So for those people, if you have excessive emotionality, we might give them an anti-epileptic or an anti-seizure medication like lamotrigine, Trileptal. These are medications that will kind of modulate this chemical called glutamate, and if you dampen down the excessive glutamate that's in the brain, you'll have a diminishing of excessive emotionality as well. But when people have strokes, yeah, it will affect sometimes your emotional state of mind. Typically, that will decrease somewhat over the course of 6 months, maybe a year. but we'll use medications sometimes to dampen down some of those excessive emotions. Thanks for your call. Let's go to our next caller. Hello, Greg. Welcome to Matters of Mind. Greg, you want to know how you get tested for adult ADHD and what's the treatment plan. I'm kind of particular in terms of determining when we diagnose ADHD for somebody, Greg. If you have adult onset ADHD, which I think is an oxymoron, that's a phenomenon where I think we need to take a deep dive and looking for other factors than the typical attention deficit hyperactivity disorder condition. In other words, if you're in your 30s, if you're in your 40s, and all of a sudden, the past few years, you notice you can't concentrate, you're distractible, you have poor attention span, poor memory, I'm going to want to know, okay, what's your thyroid status? How's your glucose doing? Do you have snoring or pausing in your breathing at nighttime? Because that could be sleep apnea. There might be other reasons why you're having trouble with attention span and focus and concentration as an adult. I'm going to look for depression. Many times people with depression will have difficulty with their speed of processing. It's as if their brain has slow internet speed and they're having a hard time going from one type of topic to another. So depression will do that. So it's like any condition, Greg. You know, if you have chest pain, we got to figure out, is the chest pain due to a stomach problem, a heart problem, a lung problem? What's causing the chest pain? And we're going to treat it accordingly. If you're having trouble with focus and concentration as an adult, we want to know, okay, how long have those symptoms been there? What's the course of them? And I'm not going to give away all my trade secrets in terms of how we diagnose ADHD, but because much of ADHD diagnosis will be based on a person's history and their current presentation. So how do we treat ADHD? It's not always with stimulants. Many people will say, I have this symptom, this symptom, this symptom of ADHD, so I need a stimulant. It doesn't always work that way. Stimulants are like eyeglasses. Not everybody will do well with eyeglasses. If your brain needs eyeglasses for the purpose of correcting your vision so that your vision can process the visual images in the back of your brain, great. Eyeglasses can be great for helping you focus your vision if you have poor vision. In the same way, stimulants are yet one treatment. They're not the only treatment. They're a treatment for ADHD. We'll use some non-stimulant medications for some people. Many people will do best with a medication used for depression, like bupropion, also known as Wellbutrin, or vortioxetine, also known as Trintellix. These medications are used for depression, but they also do a good job for focus and concentration and processing speed, especially if somebody does have some underlying depression. So there's a lot of different factors out there, but with ADHD, by definition, it starts when you're a child, and it's there more days than not. And if you take a medication as like a stimulant for ADHD and you really don't have ADHD, it's like somebody wearing eyeglasses who doesn't really need the eyeglasses. Your vision will be worse if you don't need eyeglasses. If you start wearing them, you don't have supervision if you start wearing eyeglasses. If your vision doesn't need to be corrected and you wear eyeglasses, your vision's worse. The same is true in many cases with ADHD treatment. If you take a stimulant, you'll feel some energy and you'll think, hey, this is great. But the problem is your energy is a side effect from the stimulant. The stimulant actually can make your focus and concentration somewhat worse. You can be more irritable, more jumpy. You'll make more mistakes, and that's actually been studied. People who take a stimulant who don't have ADHD typically have a tendency to make more mistakes in their cognitive processing. So we got to get the diagnosis right, and we got to find the right fit of the medication for you, as well as the dosage. Not everybody does really well with high doses of stimulant medications or ADHD medications in general. Some people need lower doses. It's all individualized, and it needs to be very carefully assessed by a clinician. Thanks for your call. Let's go to our next caller. Hello, Shannon. Welcome to Matters of the Mind. Shannon, you want to know, why does stress and anxiety mess with your short-term memory? Shannon, there's three major networks in the brain that we now understand. We used to talk about serotonin, dopamine, and norepinephrine all the time. Now we're talking about these three networks. There's the default mode network, there's the salient network, and then there's the executive network. So let's start with the default mode network. The default mode network just has you chill out. You're thinking about your past life. You're not thinking about a whole lot. The default mode network is what many people will actually use as they're just sitting around the house, or actually when they have what's called highway hypnosis and they're driving for long periods of time, not thinking about anything in particular, and all of a sudden they realize they're 10 miles down the road and they have no idea how they got there. It's a normal phenomenon, but your brain is kind of like in this default standby mode where you're not thinking about a whole lot of stuff. However, in that standby mode, you are often thinking autobiographically about stuff that's happened in your life, and you're kind of daydreaming about things. And it's in that default mode that many people will get stuck brooding, and they start dwelling on stuff and past regrets and past misgivings. The salient network is like a means of shifting from the default mode network to the executive network. If you've ever driven a manual shift, we used to have manual shifts where you'd have the gear going from first gear to second gear, and you have to change gears. You had to clutch and then change from one gear to another. The salient network is like the clutch. It allows you to go from the default mode network, the kind of the ruminative, brooding, autobiographical network where you're not really thinking about a whole lot of stuff, to the executive network where you're really thinking carefully about things and you're focusing, concentrating, and you're paying attention to things. You've got to shift, you got to engage that clutch with the salient network to get to the executive network. When somebody's under stress, now stress is okay. Stress just means a change in your life. Stress is all right. I mean, it keeps our lives from being boring, but stress in which you have difficulty coping with the overwhelming stress, the overwhelming change that's occurring in your life, that's where it creates anxiety. And when you have anxiety, your little amygdala up here in the front part of your brain gets set off, and that's your anxiety, fear, and anger center of the brain. That sets off and it hijacks the ability of your brain to go from the default mode network to use that clutch of the salient network to get to the executive network. So you can't go from the default gear to the executive gear because the clutch isn't working so well. So you get stuck in ruminating, dwelling about things. You have paralysis of palpitations and fear and anxiety, and you just can't get things done. And you can't concentrate worth a darn because your front part of your brain's not working. That's where the executive network lies. So when you're under a lot of difficulty with stress in which you cannot tolerate, that will cause you to have the inability to get into that gear of the executive network. And that's where we'll often try to recognize that for people to allow them to basically grease that clutch a little bit. And that's what medication will often do. The medication will often allow your clutch to work better to get you from that default mode network to the thinking network, the executive network, because that's frequently seen with people who have a lot of stress and a lot of anxiety. Thanks for your call. Let's go to our next caller. Hello, Alex. Welcome to Matters of the Mind.
Hey, doctor, I had a question for you.
Certainly, Alex.
I was wondering, hyperactivity is that something related to anxiety? Is it a blood thing? Is it a brain thing? Or I remember being younger and our parents tried to diagnose us with hyperactivity, but I just more got happy when Candy was around or stuff, and I didn't even know if I was really hyper. I don't think I'm hyper now. What do you think? Thanks a lot, doctor.
Alex, that's how it often works out. And sugar, sometimes parents will insist that sugar will certainly affect the demeanor of their children and give them more hyperactivity, and there could be some effects on insulin, the actual glucose levels themselves. So, that can be a factor, and that's why it's very careful to try to regulate how much sugar intake, especially the refined sugars children are getting. Boys are more likely to have hyperactivity related to attention deficit disorder compared to girls. Hyperactivity where it's problematic and detrimental is where it's something that probably could or should be treated. So if you're disruptive in the classroom, you can't socialize, you're never invited to stay overnight with friends because you're so hyper and so disruptive, that could be problematic for you. And where that is a particular problem, Alex, is where people get into trouble when they're in their teens and young adult years. Half of the people who are in prison systems nowadays have what's considered to be attention deficit hyperactivity disorder based on their having poor decision-making, impulsivity, and lack of regards for others in some cases will go along with that. But it's thought that ADHD will contribute in some cases to poor judgment, even criminal behavior for some people, not everybody. The thing about ADHD, people with ADHD typically have higher IQs compared to people without ADHD. So they tend to be smarter. It's just they just don't make good decisions. Now, you had mentioned you were hyper as a kid, Alex, and now you're not. That's fantastic, because that's what happens. As you go through life, many times the hyperactivity, the impulsivity will decrease significantly, but you might have still difficulty with attention span and focus. It's not an issue unless it's causing you trouble on the job or you're with your relationships. Now, many people will have difficulty with attention span and focus if they're doing things that are not challenging, interesting, or novel, or exciting. And if they can stay involved in something and really be engaged, they're going to be fine. So if you're in a work environment that's very stimulating for you and it's allowing you to pay attention, and on top of that, you're getting along with your family members, your social relationships, and the difficulty of conversations is not problematic, that's not an issue for you. So there's different degrees of attention deficit disorder. For some people, it's highly problematic. They need treatment where it's causing them impairment on the work force and school with social relationships. But for other people, they notice it's there, but they can adapt and they're able to work around any symptoms that might be lingering. But the hyperactivity will often decrease as somebody gets older, Alex. Alex, thanks for your call. Let's go to our next caller. Hello, Peggy. Welcome to Matters of the Mind. Peggy, you wanted to know about medications for stroke symptoms, and are they available over the counter? Is there anything you can do to stop the crying itself? Peggy, the stroke symptoms to which you had referred specifically were the crying symptoms. Now, for crying symptoms, there are medications that primarily will increase serotonin, and that is if you don't have a history of having a hemorrhagic stroke. A hemorrhagic stroke, Peggy, is where somebody would have bleeding in the brain, and that caused their stroke itself with decreased blood flow. So we're going to look at that case individually, but there are medications that increase serotonin that help with that. So we'd use medications such as Prozac, Paxil, Celexa, Zoloft, Lexapro. These are all medications that will dampen down the excessive emotionality by increasing serotonin. But you have to be careful about that, because if you've had a hemorrhagic stroke where the stroke was contributed to by a brain bleed, we'd probably want to use a different type of medication, like an anti-epileptic medication such as lamotrigine or Trileptal. Those can be medications that will stabilize the mood. These medications are not available over the counter, Peggy. And I don't think, if you've had a stroke, you don't want to be taking medications over the counter for your brain. You want to be very careful what you give your brain. You want to go through a neurologist, a primary care clinician, perhaps a mental health clinician, for the purpose of knowing that you're getting the right medication for your condition. I wouldn't suggest you're taking supplements, for instance, if you've had a stroke, because you can actually make the condition much, much worse. For instance, if you take something like ginseng and you've already had a hemorrhagic stroke, that could be fatal for you, because the ginseng can actually increase the bleeding that could be there. So I'd follow your clinician's directions for the purpose of knowing how to best decrease your symptoms you're experiencing. Peggy, thanks for your call. Let's go to our next email question. Our next email reads, Dear Dr. Farver, I'm experiencing heavy grief, both from the loss of a family member and a breakup. I've dealt with depression before. What are some ways I can keep from sliding into a deeper depression in between my therapy appointments? Loss itself. Loss is a key precipitant for depression. So if you've had a loss of relationships, loss of job, loss of a loved one, loss will often precipitate depression itself. And one of the best ways to overcome a loss of a relationship like that, whether it be through death or a breakup, can be to maintain socialization. Many people will get more socially isolated when they get depressed. And it's a vicious cycle, because the more social isolation you will endure, the more likely you'll get depressed. We saw this during the COVID pandemic with all the social isolation restrictions. More and more depression was prevalent within the community because people were not allowed to socialize as they did before. And it was a very dangerous, volatile type of setup that we saw, and we're seeing some of the repercussions now. So the best thing you can do if you've had loss of relationships, breakups, you've had deaths in the family, is to try to keep yourself socially active. And as always, we always tell people to try to stay physically active as well. Physical exercise is one of the best means of treating depression in between the therapy appointments. We'll use medications for some people if we find that the medications could be beneficial for them, but socializing and exercising are two of the best ways that you can decrease the depressive symptoms and decrease the likelihood that they'll reoccur. Thanks for your call. Let's go to our last email in these last couple minutes. Last email reads, Dear Dr. Farver, do people diagnosed with bipolar disorder also suffer from depression? How are the two different? Bipolar disorder consists of about 1 out of 25, maybe 1 out of 50 of the cases of depression. So when you have depression itself, you have difficulty enjoying things, problem with motivation, maybe sleeping too much or too little, trouble with concentration, poor energy, and so forth. With bipolar symptoms, you can have several days worth of feeling especially hyped up, decreased need to sleep, more impulsivity, racing thoughts. If it goes on for 4 to 6 days, it's called bipolar 2 disorder. Where it's 4 to 6 days of having little highs with 2 weeks or more of lows. And then you can have bipolar 1 depression where you have over 1 week of sky-high incapacitating mania, but that can be followed by depression. It's very important that we as clinicians sort those out. Now, there is something called a mood disorder questionnaire, MDQ. It's a 13-question questionnaire that gives us a clue if somebody has bipolar symptoms or not. If they answer affirmatively to 7 or more of the questions, it's suggestive that if they're occurring with a certain pattern, they might have bipolar disorder. But bipolar depression, where somebody has little highs or even big highs, but then followed by big lows, those are the type of diagnoses that really warrant the use of a mood stabilizing medication. The way I often describe it will be, when you have bipolar disorder, what you need is a cruise control on your mood as opposed to pushing on the accelerator. Thanks for your email. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. I'm psychiatrist Jay Favre, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.